the anxious person is anything but that. They go to bed and they turn off the light and their mind is focused on lots of negative thinking, evaluating what happened during the day in a negative way, worried about this, worried about that.
Dr. O'Sullivan, as a psychiatrist for many, many years, and having even taught psychiatry in medical school, can you talk about the sleep problems that are related to anxiety disorders?
Up to 50% of people with anxiety disorders will also have sleep problems. In fact, sleep and anxiety are very closely linked. I think it's fair to say that both insomnia or sleep difficulties and anxiety are two of the commonest symptoms in psychiatry and mental health. They appear in so many different conditions. Lack of sleep, chronic lack of sleep, can result in anxiety. Chronic anxiety can cause sleep problems. So there's a close relationship between the two.
And what types of sleep problems are there?
Well, we can look at it this way. We can have difficulties getting to sleep, going to bed at night and not being able to get to sleep. Then we have broken sleep or difficulties staying asleep throughout the night. And finally, we can have problems with the duration of sleep, how long we sleep. We wake in the morning and instead of being ready to face the day, refreshed and motivated, we wake or we get up feeling tired and stressed and generally not in a good position to start our day.
So you were a medical doctor that went on to specialize in psychiatry. Can you talk about the physiological benefits of sleep? Why is it so important to our mental health and well-being?
Sleep plays a vital role in the physiology of our brain. Indeed, the physiology of our body, but especially our brain. And research has shown that sleep is vital for example, the consolidation of new information, short-term memory. Sleep is important for immune function. The immune system needs consistent sleep. Sleep is important for growth hormone regulation, cell repair, and the removal of the byproducts of brain cell metabolism. We talk about REM sleep and non-REM sleep, different stages of sleep. So sleep is quite a complex condition or thing, and obviously vital to our health.
With all those benefits of sleep physiologically, you can see why it would be so linked with anxiety.
When you think about it, we go to bed at night and we need to be in a relaxed mental state and a relaxed physical state to get off to sleep. Now, the anxious person is anything but that. They go to bed and they turn off the light and their mind is focused on lots of negative thinking, evaluating what happened during the day in a negative way, worried about this, worried about that, indeed, anticipating negative things in the morning. So this is not conducive to getting off to sleep. Also the body is tense, restless, and not in a relaxed state. So anxiety and a good night's sleep are not the best of friends.
I wanted to ask you about sleep as a priority in treatment. I've heard of people who have recovered from an anxiety disorder say that the first thing they had to do was get their sleep on track, that they couldn't really take on the other aspects of their treatment until their sleep was improved. Is this the case, and is sleep really a priority in treatment?
I think it is. I think that taking on the task of recovery, it's a challenge. It's not easy. And it's essential, I think, to have a stable night's sleep on a consistent basis when taking on that demanding task. When you think about it, sleep deficiency results in all sorts of negative symptoms: poor concentration, short-term memory, indecision, low energy level fatigue, moodiness. And so we're exposed to those symptoms if we don't have a consistent night's sleep. And then we're expecting that we'll take on the task of reintegrating into work, our family, social functioning, and things like that. So absolutely, it's important that we focus on dealing with our sleep problem.
I wonder sometimes if medical people provide enough focus on sleep when assessing, when prescribing, when dealing with clients. Sometimes anecdotes I've heard, and I'm not sure if you can comment on this or not, but sometimes I wonder if medical people put enough focus on sleep when providing treatment plans.
I think that is very true. And you know the old saying, physician, heal thyself. I think that applies to doctors because they're on call. I mean, I know this from my own experiences. Being on call, having to face into a work, having been called 2 or 3 times during the night. And when we talk about fatigue and concentration and all of that, most physicians are very familiar, sadly too familiar, with the side effects of sleep deficiency, sleep deprivation. So let's move on to another subject.
Okay. We're next going to talk about ways that people can improve their sleep.